The truth about drugs and what you should know about them and how they destroy millions of lives every year. This information was taken from a pamphlet that you can find on drugfreeworld.org. Today, I will be doing a read along, but you can go onto the website at drugfreeworld.org and get a full scoop of all of the different information that they have to fight the drug abuse and the drug issues and the drug problems going on in the world at drugfreeworld.org. Why was this booklet produced? Because there's a lot of talk about drugs in the world, on the streets, at school, and on TV and the internet. Some of it's true and some not. Much of what you hear about drugs actually comes from those selling them. Reformed drug dealers have confessed they would have said anything to get others to buy drugs. Don't be fooled. You need facts to avoid becoming hooked on drugs and to help your friends stay off of them. That is why this booklet was created for you. Our drug culture. Drugs have been part of our culture since the middle of the last century. Popularized in the 1960s by music and mass media, they invade all aspects of society. An estimated 208 million people internationally consume illegal drugs. In the United States, results from the 2007 National Survey on Drug Use and Health showed that 19.9 million Americans, or 8% of the population aged 12 or older, used illegal drugs in the month prior to the survey. You probably know someone who has been affected by drugs directly or indirectly. The most commonly used and abused drug in the US is alcohol. Alcohol-related motor accidents are the second leading cause of teen death in the United States. The most commonly used illegal drug is marijuana. According to the United Nations 2008 World Drug Report, about 3.9% of the world's population between the ages of 15 and 64 abuse marijuana. Young people today are exposed earlier than ever to drugs. Based on a survey by the Center for Disease Control in 2007, 45% of high school students nationwide drank alcohol and 19.7% smoked pot during a 1-month period. Why do people take drugs? People take drugs because they want to change something about their life. Here are some of the reasons young people have given for taking drugs: to fit in, to escape or relax, to relieve boredom, to seem grown up, to rebel, to experiment. They think drugs are a solution, but actually the drugs become the problem. Difficult as it may be to face one's problems, the consequences of drug use are always worse than the problem one is trying to solve with them. The real answer is to get the facts and not to take drugs in the first place. How do drugs work, you might ask? Well, drugs are essentially poisons. The amount taken determines the effect. A small amount acts as a stimulant, which means speeds you up, and a greater amount acts as a sedator, meaning it slows you down. An even larger amount of poison can kill you. This is true of any drug. Only the amount needed to achieve the effect differs. But many drugs have another liability. They directly affect your mind. They can distort the user's perception of what is happening around him or her, and as a result, a person's actions may be odd, irrational, inappropriate, and even destructive. Drugs block off all sensations, the desirable ones with the unwanted. So while providing short-term help and relief of pain, they also wipe out ability and alertness and muddies one's thinking. So medicines are drugs that are intended to speed up or slow down or change something about the way your body is working, to try to make it work better. Sometimes they are necessary, but they are still drugs. They act as a stimulant or sedative, and too much can kill you. So if you do not use medicines as they are supposed to be used, they can be as dangerous as illegal drugs. Drugs affect the mind. Normally when a person remembers something, the mind is very fast and information comes to him quickly. But drugs blur memory and cause in blank spots. When a person tries to get information through this cloudy mess, he can't do it. Drugs make a person feel slow and stupid and cause him to have failures in life. And as he has more failures and life gets hard, he wants more drugs to help him deal with the problem. Drugs destroy creativity. One lie told about drugs is that they help a person become more creative. The truth is quite different. Someone who is sad might use drugs to get a feeling of happiness, but it does not take work. Drugs can lift a person into a fake kind of cheerfulness, but when the drug wears off, he or she crashes even lower than before, and each time the emotional plunge is lower and lower. Eventually, drugs will completely destroy all the creativity a person has. These are some basic facts about commonly abused drugs. Marijuana. Marijuana is usually rolled up in a cigarette called a joint or a nail. It can also be brewed as a tea or mixed with food or smoked through a water pipe called a bomb. Cannabis is number 3 of the top 5 substances which account for admission to a drug treatment facility in the United States at 16%. According to a national household survey on drug abuse, kids who frequently use marijuana are also 4 times more likely to act violently or damage property. They are 5 times more likely to steal than those who do not use the drug. Marijuana is often more potent today than it used to be. Growing techniques and selective use of seeds have produced a more powerful drug. As a result, there has been a sharp increase in the number of marijuana-related emergency visits by young pot smokers. Alcohol. Alcohol depresses your central nervous system, your brain and spinal cord, lowers inhibitions, and impairs judgment. Drinking large amounts can lead to a coma and even death. Mixing alcohol with medications or street drugs is extremely dangerous and can be fatal. Alcohol influences your brain and leads to a loss of coordination, slow reflexes, distorted vision, memory lapses, and blackouts. Teenage bodies are still growing, and alcohol has a greater impact on young people's physical and mental well-being than older people. Some short-term effects: feelings of warmth, flushed skin, impaired judgment, lack of coordination, slurred speech, memory, and comprehension loss. Heavy drinking usually results in a hangover, headache, nausea, anxiety, weakness, shakiness, and sometimes vomiting. Long-term effects. Tolerance to many of the unpleasant effects of alcohol and the resulting ability to drink more. This leads to a deteriorating physical condition that can include liver damage and increases the risk of heart disease. A pregnant woman may give birth to a baby with defects that affect the baby's heart, brain, and other major organs. A person can become dependent on alcohol. If someone suddenly stops drinking, withdrawal symptoms may set in. They range from jumpiness, sleeplessness, sweating, and poor appetite to convulsions and sometimes death. Alcohol abuse can also lead to violence and conflicts in one's personal relationships. Cocaine and crack cocaine. Cocaine and crack cocaine can be taken orally through the nose, snorted, injected with a syringe, or in the case of crack, through inhalation of the fumes from heating it. The terms used to describe ingestion include chewing, snorting, mainlining, injecting into a large vein, and smoking. The word cocaine refers to the drug in a powdered form, and a crystal form, crack. Some street names: Coke, Crack, Flake, Rock, Snoke, Charlie Sniff. It's made from the coca plant, and next to methamphetamine creates the greatest psychological dependence of any drug. Some short-term effects: cocaine causes a short-lived intense high that is immediately followed by the opposite: intense feelings of depression and edginess and the craving for more of the drug. People who use it often don't eat or sleep properly. They can experience greatly increased heart rate, muscle spasms, and convulsions. The drug can make people feel paranoid, angry, hostile, and anxious, even when they ain't high. Long-term effects: in addition to those effects already mentioned, cocaine can cause irritability, mood disturbances, restlessness, paranoia, and auditory hallucinations. Tolerance to the drug develops so that more is needed to produce the same high. Coming down from the drug causes severe depression, which becomes deeper and deeper after each use. This can get so severe that a person will do almost anything to get the drug, even commit murder. And if he or she can't get cocaine, the depression can get so intense it can drive the addict to suicide. Crystal meth and methamphetamine. Crystal meth and meth are inhaled, smoked, or injected. Low doses are in pill form. Crystal meth is a form of methamphetamine that resembles small fragments of glass or shiny blue-white rocks. On the street, it is known as ice, crystal, glass, and other names. It is a highly powerful and addictive man-made stimulant that causes aggression and violent psychotic behavior. Many users report getting hooked, addicted from the first time that they use it. It is one of the hardest drugs to treat. Some of the street names is speed, meth, crystal, crank, that sweet, go fast, ice, glass, Tina, quartz. Short-term effects. Negative effects can include disturbed sleep patterns, hyperactivity, nausea, delusions of power, increased aggressiveness, and irritability. Can cause decreased hunger and bring on weight loss, and higher doses has a greater rush, followed by increased agitation and sometimes violence. Other effects can include insomnia, confusion, hallucinations, anxiety, and paranoia. Can cause convulsions leading to death. Long-term effects: increased heart rate and blood pressure, damage to blood and vessels in the brain, leading to strokes or irregular heartbeat and cardiovascular collapse or death. Can cause liver, kidney, and lung damage. Users may suffer brain damage, including memory impairments and an increasing inability to grasp abstract thoughts. Those who recover are usually subject to memory gaps and extreme mood swings.